Ladies and gentlemen, World Hypertension Month alerts all medical practitioners to the importance of proper diagnosis and effective treatment. In our commitment to public health and professional service, IPCA proudly presents a daily take-home message throughout this month. These insights are provided by the eminent Padmashri Dr. C. Venkata S. Ram, a global legend recognized for his pioneering contributions to our understanding of hypertension. Listen to Dr. C. Venkata S. Ram's today's message.
Greetings to my fellow medical practitioners all over the country. In connection with the World Hypertension Month of May, the message for today is on the role of calcium channel blockers for the treatment of hypertension. For many, many years, calcium channel blocking drugs have been recommended for the treatment of hypertension. Verapamil and diltiazem are not that useful for hypertension, but dihydropyridine calcium blocking drugs like amlodipine are versatile antihypertensive drugs, quite effective in the treatment of hypertension, either as monotherapy or in combination with other antihypertensive drugs. In fact, almost all the guidelines strongly recommend using a calcium blocking drug in the treatment of hypertension initially or as an add-on drug. One drug that has been and still is very popular is amlodipine, a number of positive outcome trials and quite effective in the treatment of hypertension. But the drawback is it can cause ankle edema, and in some patients who have proteinuria, it can increase proteinuria in patients who have diabetes. And in some patients, it can cause headache. So there are some disadvantages of amlodipine despite the cardiovascular benefits, namely causing activation of sympathetic tone, tachycardia, aggravating proteinuria. These are some of the disadvantages of amlodipine. The new generation calcium blocking drugs, such as azelnidipine, is somewhat superior to amlodipine in terms of the safety and tolerability and acceptability by the patient. Azelnidipine, unlike amlodipine, does not cause tachycardia. Azelnidipine may actually cause a decrease in proteinuria, and azelnidipine does not activate sympathetic nervous system. So azelnidipine is as effective as amlodipine, but does not cause amlodipine-like side effect. So this is a new generation calcium blocking drug that reduces the blood pressure exactly like amlodipine, but offers freedom from side effects that amlodipine used to cause. So again, azelnidipine and amlodipine are equally effective in the treatment of hypertension, but azelnidipine offers some benefits over amlodipine in terms of cardiovascular effects, and it also in causing freedom from ankle edema, and it also provides so-called renal and neurological protection. So you have choices now in the treatment of hypertension, which dihydropyridine can be used based upon the evidence that is available, and hopefully based upon some of the comments I have made on the role of calcium blocking drugs in the modern treatment of hypertension.